Now on Talking Solutions, welcome into our studio, Janel Davis. What is your position with the Silver State Health Insurance Exchange?
I am the communications officer. This is my second open enrollment period. I started at the exchange in June of 2015.
This is not your first rodeo.
This is not my first rodeo. There's a lot going on, that's for sure.
You know, it's funny that you mentioned a lot going on because that's exactly how I feel with anything insurance related. At this point of the year, we are being deluged by a lot of very confusing things that are happening at the same time. We've been hearing a lot in past weeks about Medicare open enrollment.
Yes.
And of course, companies are doing the insurance signups for their year. I think a lot of people get barraged, and I think it just confuses them.
Yeah, health insurance is already confusing, and now we have a post-election with lots of varying headlines in the news of what's going to happen to the Affordable Care Act. And I think it's really important for people who are listening to understand that there will be a transitional period. I don't know how long it's going to last. I can't speculate. I'm not a policymaker, but I want to ensure Nevadans and tell them that the Affordable Care Act is still a law and the individual mandate and fee still exists. So for those folks who are not currently insured by some sort of plan, then Nevada HealthLink is something that you need to look at and something that people need to educate themselves on and see that they might be eligible for one of our plans.
Janelle, I agree with you completely. I go out and do a lot of speeches. One of the things that I always make a point to mention is life has no guarantees. So we need to live for now. And the fact is, people's health is of extreme importance, especially. I know parents, it's all about the kids. They're not as worried about themselves, really. It should be a whole family effort. But insurance and health is of extreme importance. Since we don't know what's going to happen down the road, none of us do, let's work on today and what we can take care of right now.
Exactly. I agree with you completely, 100%. We need to focus on the now. And I think a lot of people aren't considering putting health insurance and those plans into their budget. And that's what we need to do right now. We need to put that into our budget, just like our car insurance, just like our house, just like our rent, our groceries, everything else. Because if something catastrophic happens to you, you get diagnosed with something, you don't want to be in debt for the rest of your life. We're not invincible. A lot of people who are healthy, that's great. You know, a lot of our plans cover preventative care. And I just want to instill in those people who are listening to educate themselves on what's available to them, because there are a lot of resources and federal assistance and subsidies out there to really lower their monthly premiums and to cover their backs.
Good point. Janel Davis is with us, Communications Officer for the Silver State Health Insurance Exchange. We're talking about Nevada HealthLink. I think that's the first time I've actually brought the name of Nevada HealthLink into our discussion. The fact is, Nevada, living here, we're actually in one of the more fortunate states because we have the exchange to help us get the health insurance that is really so important.
Right. I would agree with that. I work for the state agency, the exchange, and then our Nevada HealthLink. It's funny that you said that for your first time. That's sort of our brand. That's our online marketplace. It's important to note that we all go online, and if we were to type in Nevada health insurance, a lot of things would pop up. And so it's really important for people to know that Nevada HealthLink is the state-sanctioned health insurance marketplace for those individuals who are eligible for a qualified health plan through the exchange.
One of the important things, too, Janelle, is through Nevada HealthLink, which is part of our state health insurance exchange, that's where you get, what do I want to say?
The subsidy?
Yes, exactly.
Assistance.
That's where we can get the help because people are so concerned about the cost of their health insurance. Fact is most of the people you deal with actually end up getting subsidies to help make it cheaper for them.
About 80% of Nevadans are actually eligible for a federal subsidy, which will help lower your monthly premium. So you may hear information about the average cost being about $250 per individual, and that's probably true. But what you don't realize is with your federal subsidy, that may cost you about $50 instead of $250. So it's really important to educate yourself. Talk to someone who understands this insurance industry. Go visit our website, nevadahealthlink.com. We actually have an in-person assistance tool on the website where you can type in your zip code or somewhere nearby, and licensed enrollment professional will pop up. It's free local help. So call these individuals, talk to them. You won't be directed to an automated system. You'll be calling their offices directly. Make an appointment appointment with them. Go talk to them. Even if you do have health insurance right now, make sure that you have the plan that you want. Even if you're on a Nevada HealthLink plan right now, it's very possible that your plans have changed, your premiums have increased. So make sure you go online or call your broker or navigator or licensed enrollment professional and find the right plan that's best suited for your health insurance needs financially and for your health.
So if you're all confused about health insurance, and you talk about the changes too, Janel, from year to year, I know in our programs, even with Beasley Media Group, every year there's something different. So we all need to get together on the same page.
It's that time of year.
Yes. You also mentioned that there's help, and it's free help.
It's free help.
I don't have to be confused.
Right. Well, and a lot of times, although the internet is right at our fingertips and it's so much easier for some people to just go online and find a plan, I will say that it can be really confusing. And so give us a call. You'll be directed to healthcare.gov, which is where you find your plans, and get that help because it's so confusing and we want to help navigate and we're here for you.
What I find is people, when they feel confused over something like insurance and all of the stuff I'm going to have to go through, it makes them freeze and procrastinate.
Procrastinate is the exact word. I'm glad you mentioned that because Nevada residents only have about 3 months for this open enrollment cycle for the exchange.
Which has already started.
It has already started. It started November 1st. We have a deadline date coming up December 15th, and then open enrollment closes on January 31st. So that December 15th date is important because if you enroll by that date, you'll have coverage by the first of the year.
They need a little bit of time in there to get it working by January 1st.
Right. And you still have time in January to enroll. You have till the end, the 31st. But a lot of people want that coverage on the 1st. You'll be covered if you hit that deadline date. Call your insurance carrier. Make sure, especially if you're needing surgery right away or you have some catastrophic issue that you need to handle, that's kind of a plus to get in by that time.
December 15th is also an important date because you've got a big event coming up, which is next Thursday.
Next Thursday, December 15th from 12 p.m. to 7 p.m. We extended our hours a little bit on that day for individuals to come to the Cashman Center. That's where we'll be. Licensed enrollment professionals will be on site available for that face-to-face interaction, and they will enroll you right then and there and answer any questions that you may have.
That way you don't even have to get on any website. You don't have to do any of the things on the internet.
Right.
All I need to do is go to Cashman Center next Thursday between noon and 7 p.m. Free event, of course.
Free event, open to the public. Anyone who is eligible for our plans, you'll find out there. Make sure to bring your Social Security and your Nevada ID, any alien cards or whatever you may need, and then also your W-2 or proof of Nevada residency.
You could do that through maybe a utility bill.
Absolutely.
I pay these guys every month, so.
Right.
Okay, well, that sounds like a great idea because would it also be true, Janel, if we went to the event at Cashman Center next Thursday, the 15th, and got everything all set up through Nevada HealthLink so that I got that coverage, will I also hit that deadline date of December 15th so that my coverage starts on January 1st?
That's exactly right. And that's kind of why we have that event on that day, not only to provide the face-to-face interaction with someone who knows the insurance market, but also because a lot of people need to get that coverage before the first of the year.
Get it all done for free, face-to-face. You won't be confused anymore. You'll have that taken care of, and then you got 10 days left to Christmas shop at that point.
Yes. And if you're doing it online and you're not able to make it to our event or you want to call our call center, you're more than welcome to do that. And the deadline for enrolling for the first of the year is midnight on Thursday, December 15th.
Gotcha. A lot of things happening on Thursday, the 15th. That's an important day for all of us to keep in mind.
Absolutely.
So, Cashman Center would be a great idea. And there is so much room in that place. I'm sure you're going to be set up with all kinds of helpful people who can take us all the way through and get it all taken care of.
Yep. There will be people guiding you where to go. Our outreach staff will be there to check you in, and we'll partner you up with a licensed enrollment professional.
Because there are a lot of plans out there for people to choose from, and that might be one of the things that they find most confusing.
Absolutely. There are gold, silver, and bronze plans. We have the same 3 carriers we have this year, which is an Anthem, which offers a PPO and an HMO. We have Health Plan of Nevada, and then also Prominence. So those are the 3 different insurance carriers that are offering plans on the exchange. Even though that's not that many, there's still a lot of different plans within those carriers. And so that's what the enrollment professional will go through with you to see, okay, this is how much you're making. This is how many people are in your household. And this doctor is in your network with this plan. And, that's what you need to find out.
That's why we need help.
Yes.
We need somebody who is able to look at it clearly.
Right. And you want to compare and you want to shop. Nevada HealthLink and healthcare.gov, it operates like an online shopping mall. But like I said, once you get to those steps of comparing is usually when the consumer needs a little bit of assistance. Like, where do I need to go from here? That's what we're here to help you with.
I'm glad you're here. And we are very fortunate. Janel Davis is in studio with us today, Communications Officer for the Silver State Health Insurance Exchange. Through them, we are able to access Nevada HealthLink. We've got open enrollment going on right now. Really important dates to keep in mind. Next Thursday, December 15th, for a couple of reasons. One is by midnight that night, we need to be signed up, choose our insurance for the next year so that it will kick in on January 1st. So we got coverage for the whole year. But also on Thursday, from noon to 7, big free event with lots and lots of free help at Cashman Center, where we can actually get assistance in getting the plan that works best for us and get us signed up in time once again for the January 1st insurance date that we were talking about.
Right. And then just to mention the open enrollment, if you don't make it by that December 15th date, you still have a little bit of time. You'll have the rest of December, but you won't get coverage until February 1st. And same goes for enrolling in January. So open enrollment closes January 31st of 2017. We also have a special enrollment period that takes place on what we call the off season. So not in the November to January months. And a special enrollment, if you qualify for a qualifying life event, meaning if you have a child, you get married, maybe your income changes. If you report those income changes or any qualifying life event that occurs in your life on the off season, then you can still enroll at that time.
A life event. We see those too when we're signing up for the company stuff.
Right.
Because they say if you've been married or I think divorce comes into play, a child, big life events give you access to changing your insurance at that point because of those reasons.
Right, exactly.
I was mentioning a little earlier how fortunate we are to live in Nevada. I always love it when Las Vegas and Southern Nevada and our state as a whole ranks really highly in categories because, quite honestly, it doesn't happen in every area.
Right.
But when it comes to insurance coverage, last year, didn't we benefit with a lot more insured children?
We did. Let's go back a few years. The first year that we had open enrollment and Nevada created its exchange, appointed by the governor and the board, we only enrolled about 32,000 individuals. The second year, we're looking at about 64,000. And then that third year, maybe about 70,000. Well, this last year, we enrolled 88,145 individuals. So we really bumped up the number. And that just shows the state, both South and North, and rural Nevada for that matter, or access to the whole state, that there's still a need for having a state-based exchange. We are a state-based exchange using the federal platform. So we use healthcare.gov, which is through the federal government, as our eligibility and enrollment purposes. So we use their technology platform. But everything is much smoother now and much simpler. And I don't know if I go as far to say simple, but in comparison to when we started operations in 2013, we're running a much tighter ship and things are much more streamlined. So I think Nevada is doing well and there still is a really good need for this. And we've covered so many Nevada lives and there's so many great stories out there for people who had a pre-existing condition, for example, like diabetes or cancer, and before they weren't able to get coverage and had no access to healthcare, but with the exchange, that was available to them, and they're just forever grateful. I think another thing, too, we see a lot of premiums going up. We see a lot of plans changing. We see a lot of carriers pulling out of the marketplace, but we need to realize and educate ourselves that that federal subsidy assistance is still available to Nevadans looking for health coverage.
The entire landscape of health insurance coverage, it's always in this state of flux.
Right.
So we need to not put it off. And I think one of the reasons why we're getting more participation, my theory, in Nevada HealthLink and the insurance exchange here in our state is because word is getting out.
Yeah.
That it does not cost me as much as I thought. Insurance coverage is right here. Let's take advantage of it today. And the preventative angle that you discussed a little earlier is so important because if you put it off, you go, I'm healthy now, I'm good.
Yeah.
We're all good for now. But the thing is the preventative that is offered helps to keep us healthy because it's the chronic conditions, it's those sudden emergencies that jack up the price and the severity. If we don't do the preventative, we really do put ourselves out there.
I totally agree. A lot of people think, oh, I'm healthy, I'm good to go. And a lot of people aren't even going to the doctor just to get regular checkups. So having that access to preventative care and being offered coverage, even if you do have a pre-existing condition, are really pros to the policy of the Affordable Care Act that was enacted so many years ago.
A friend of mine here in town, single mom, went through the insurance exchange and got coverage. She loves that her son is now covered for insurance.
Yes.
She's covered too.
Right. So that's another thing. I'm glad you mentioned that. Children are covered. We had a really high increase too of Latino and Hispanic children in Nevada who were covered as well. But I think a lot of families and parents, they really want to cover their kids, which is great, and they will be covered. But you have to think about yourself as well.
I think I was watching, this is years ago, and it just sticks in the back of your mind. It was like an old episode of Dr. Phil, and he's trying to talk sense into some woman who's on the show that day. Let me see if I can do him. If you don't take care of yourself first, you can't take care of your kids.
Right. Exactly.
I know, a little exaggerated, I realize.
No, that was good.
A little comedy in the middle of the show. But I do appreciate his point. That single mom friend of mine, most concerned about the health of her child. But if she's not healthy to start with, that's an even bigger problem.
Absolutely. Yeah.
That young child who is 7 years old is very dependent on his mom. We need the whole family to be healthy. And fortunately, by stepping up and taking advantage of the health coverage that is available to you, you really can benefit everyone in the family.
Absolutely.
It's very important.
It is important.
Janel Davis is Communications Officer for the Silver State Health Insurance Exchange. We're talking about Nevada Health Link and your access to insurance coverage. The open enrollment period is on now. We were talking a couple moments ago about how December 15th is a very important day, and that's coming up next Thursday.
Yeah, already it's coming up. Open enrollment started November 1st. We had a kickoff event that day to start out the season. There's a lot of other open enrollments going on. So again, I want to be clear that the folks who are eligible for these qualified healthcare plans, if you're listening and you're thinking to yourself, well, I already have a plan, or I'm through this way, or I don't even know if that's available to me, you can find out more information on that December 15th date because we're having an event. You can also find more information on our website at nevadahealthlink.com. But the folks who are eligible or possibly eligible are really a wide spectrum of folks. We're talking anywhere from age range 18 to the 50 plus generation. We did an off-season campaign where we really focused on a more specific target niche audience, which was rural Nevada, the tribes, the Hispanic Latino population, which is a pretty big percentage of our enrollments.
Yeah.
Millennials, that's another tough group to reach. The 50-plus generation, a lot of those folks are interested in finding plans. These are individuals who are not eligible for Medicare, but would be eligible for a plan through the exchange, or they're interested in finding help for their grandchildren because it's that time and they need coverage too. And then other ethnicities as well. But like I said, these are really plans that are eligible for folks who currently do not have a health insurance plan through their employer, or they do and they're underinsured, or maybe their plans have changed. So contact your carrier, contact your broker, get that in-person assistance to see what's out there for you.
You might as well check into it. Janelle, let's say someone's listening to us and they're going, gosh, I'd love to know if I'm eligible for some of those, what do we call it?
Subsidies.
Thank you.
Which really means insurance has very confusing terms to it, especially health insurance. A subsidy would be federal assistance from the government to help pay your monthly premium. So you pay a monthly premium to your carrier. It's known as a per member per month fee. And the government will help assist you through that monthly premium. But to see if you're eligible, the first step that Nevadans need to do is go to nevadahealthlink.com. Directly from the home page, it'll say Get Started. You'll take a pre-screener, which is a series of about 4 to 5 questions. It needs to determine your income, how many people are in your household, do you smoke, these types of things. Are you pregnant? To see if you are eligible. And mainly it's because they want to know your income. These are income-based plans to see if you're eligible for that federal assistance, or maybe you're eligible for a different plan, or you might even be eligible for Medicaid. If you're eligible for Medicaid from that pre-screener, it will direct you to their website. If you're eligible for federal assistance through the exchange, you'll stay on that page, then you'll go to healthcare.gov, and then you can start to search for your plan.
So with 4 or 5 little questions, by going to NevadaHealthLink.com, it's going to direct me to the place where I really belong.
Exactly. And if that's even too much, go ahead and give us a call. We'll answer right away. You won't be put through an automated system like the federal system. You know, the healthcare.gov, it's all automated. I believe Medicaid is too, but we have a call center that we share our office in Carson City, and they'll answer the phone. And then they can direct you where you need to go and sit on the phone and go through the process with you, really.
And they'll be all calm and they'll hold your hand theoretically. They will help to guide you with common sense assistance.
Correct.
We all need the insurance because we get fined if we don't have health insurance at this point in time, right?
So we get fined if you do not have a health insurance plan through your employer or through the exchange or private industry, whatever. You will get fined when taxes come around. And the fee right now is $695 per individual or 2.5% of your annual income, whichever is higher. For families, that increases. It's not $700. We're talking thousands of dollars fined here. So really, you need to educate yourself and find out how we can budget this, what really is going to work for myself and my family, because the fee still exists. There may be a lot of people out there saying, oh, well, the Trump administration is going to repeal and replace the Affordable Care Act. But as it stands right now, even if he vetoes the bill in January, when he takes office, the fine still exists. It's still a law. It's still a policy. So you still will get fined, or you'll have to apply for an exemption. But the Affordable Care Act is still a law. So I just want everybody who's listening to know that we still encourage Nevadans to shop the marketplace. It still exists. The penalty and the fine is still there.
We don't know what's going to happen down the road.
No.
But even early into it, after the election, Mr. Trump himself said, the pre-existing thing, I think that's good.
Yeah, there are really good parts of the Affordable Care Act. And the president-elect has said that he wants to protect consumers. He wants to protect them and their subsidies, those federal assistance that's available. And he wants to keep children on their parents' plan till they're 26. These are the things that he has told the American people that he wants to keep and that he likes. So it'll be interesting to see how we keep that, but then repeal the law.
It's going to be interesting. We'll all just have to watch.
Yes.
But I'd rather watch while I still have my coverage. And that's what we're emphasizing is right now, this is the way it is. We don't know what will happen down the road. And sometimes nothing happens because it's politics.
It could
so you
be
never
years.
know.
It could be years.
So right now for today, for your health and the health of your family, we should take advantage. And in Nevada, we are more fortunate than many other states who didn't opt to have an exchange for whatever reason.
That's very true. And 88% of our enrollees qualify for that federal subsidy. And we enrolled over 88,000 individuals this last open enrollment. We're hoping to see enrollments going on right now. Those numbers are staying fairly in that realm. So we hope to see more people get covered. And that's our main goal here.
And I believe that that's because the word's getting out that it's not as expensive.
Well, I hope so.
And it's not as hard as they thought it was.
Yeah.
And I have also heard the other side of it where a family says it would cost $10,000 a month. No, it's not going to cost $10,000 a month, especially if your income is such that you get subsidies.
Right.
So until you check into it, you don't know how much it's going to cost or how little.
Right, exactly.
Long process to find that out by going to NevadaHealthLink.com?
Not really a long process. Visit NevadaHealthLink.com. The pre-screener is about 4 to 5 questions long. That'll take you just a couple minutes. You will need to have your estimated annual income for 2017 readily available. The plans are income-based, so that's how we determine if you're eligible for either Medicaid or a qualified health plan through the exchange. Also, give us a call, send us an email. We're here to help you. The process to actually enroll online by yourself could take about 30 to 45 minutes, and same with in-person. But when you have that face-to-face interaction, you know what you're getting because you're talking to folks who understand the marketplace.
We've got a really important date for a couple of reasons, Thursday, which is December 15th. In a perfect world, everybody would have insurance coverage on January 1st.
Yes.
And if you want to have that insurance coverage as the year begins, you need to be signed up by the end of the evening on Thursday night, which is December 15th.
That's correct. And on that day, we're actually holding an event. It's a mid-season open enrollment event. It's an opportunity for Nevadans to go get in-person assistance and actually sit there and enroll with a licensed enrollment professional. And it's free local help at the Cashman Center from 12 p.m. to 7 1 p.m. A big window of time, free event, open to the public, and we're here to help you find a plan.
And the things that someone needs to bring along?
So proof of Nevada residency, that could be a bill, your ID, your social, and then your W-2s from previous years, and then just know your estimated income. So same if you were doing it online, you'll need to provide that information because it's one of the first questions they ask.
Grab a pay stub. You'd have the information right on there that you would
do
need. It is a free event coming up Thursday, December 15th at Cashman Center with Nevada HealthLink. Janel Davis, Communications Officer for the Silver State Health Insurance Exchange. Am I forgetting anything?
I don't think so. I just want people who are listening to know that there's access to healthcare. We're here to help you. I know there's a lot of weariness going on with the new president-elect and what's going to happen to the Affordable Care Act, but just know that federal assistance and subsidies are still available to you. Premiums have gone up, but not so much in Nevada, and 88% of Nevadans are eligible for that federal help. So get out there, get coverage. We're here to help you enroll.
And you would want to take care of that sometime this week because on Thursday, December 15th, it's that deadline for us to all get covered for January 1st.
Right. Even if you miss that, you still have a little bit of time. Open enrollment closes January 31st of 2017.
And looking down the road, for people who missed the December 15th deadline to get that insurance covered by January 1st, they still are able to get health coverage. It just won't be available on that January 1st date.
If you enroll in January or even after the 15th of December, you still have an opportunity to enroll, and we encourage you to shop the marketplace, and then you will have coverage by February 1st.
And I believe I also saw that you've got one of those last-minute events because we know January 31st, that really is the big date, that if you want to get the coverage.
We have a closeout event taking place on Sunday, January 29th. And the reason we do that is we give ourselves a couple-day cushion so that there's still time for those folks to enroll in the next couple of days and get all the kinks worked out because it's all done online and those sorts of things.
Do you find, Janel, that a good percentage of the people that you deal with, when it comes to insurance, their head just spins and they go, "Whoa, I don't get it"?
Well, I'm not a broker or sales agent, but I will say the conversations that I've had, especially as the communications officer, I'm in talking with the media, there's still a lot of concerns and a lot of questions. Even when we started all of this, it was confusing. Talking about things like deductible and subsidy and copay can be very tricky and confusing. I think still it is to this day for a lot of folks. And that's with any type of insurance company. So now it's a much more streamlined process, but there's really a lot of resources out there for people, and that's what I want them to know.
What I'm getting from our conversation is that the most important thing of all is that we should have insurance coverage for our own good.
We're not invincible.
That's right. For us, for the kids, for the family, preventative to help us avoid being ill if we can do that. Bottom line, insurance is important for all of us. We do have access to it easily in the state of Nevada, thankfully. And every year, more and more people and children are getting involved in having this insurance coverage that is so important for their health.
Agreed, completely.
NevadaHealthLink.com will get you started. A few easy questions will help to get you the information and the help that you need.
I also just want to throw our call center number out there. So if you don't have access to a computer or the internet, but you have questions after listening to this, we are available in our offices Monday through Friday, 8 to 5. And that phone number is 1-855-768-5465, and someone will answer. You won't be put through an automated system. We can also hook you up to healthcare.gov to log into your plan if you currently do have a plan through the exchange. Just give us a call if you have questions. We're here to help.
That number again, 855-768-5465. I'll have that number, the links, and a podcast of our conversation on our Talking Solutions Facebook page, like always.
Great.
Janel, is there anything else?
I think we covered everything. I really appreciate you having me and hope everyone got some good information.
We appreciate that you're here to tell us that it's not as scary or hard as we might think.
Yeah, exactly.
NevadaHealthLink.com, all the info on our Talking Solutions Facebook page, along with the podcast of the interview. I think you're going to be busy for the next couple of months.
It is a busy time, yes. It always is, even in prepping for open enrollment, because we realized hey, we still need to talk to our consumers on the off season because one, they might be eligible for a qualifying life event. So for the special enrollment period, they could probably still enroll. And two, for those target audiences and demographics who we still need to reach and may not realize that this is an option for them.
It might be a lot easier to access, a lot less expensive than you think, and a really important thing to add to your life if you don't already have it. And we want to avoid the penalties on the taxes. So easy way to do all of that is just take care of it through NevadaHealthLink.com.
Yes.
Janel Davis, Communications Officer for the Silver State Health Insurance Exchange. Thank you so much for joining us today on Talking Solutions.
Thank you for having me.
Talking Solutions is a production of the Community Relations Department here at Beasley Media Group Las Vegas. Get more information on today's topic on our Talking Solutions page on Facebook, where you will also find links and a podcast of today's show. Thanks for listening, and have a great week.